Hi everyone, my name is Will Goodbourn. I'm a sports massage therapist and biomechanist. I'm here today to give you some exercises for some commonly affected areas where you're sitting down all day. So one of these areas is your hip flexors. So when we're sitting at our desks, we're shortening these muscles. These get tight, but also this can also affect your lower back, so it ties into what we were doing in the last session. So when these muscles tighten, the main hip flexor muscle, the psoas major, joins onto the spine, so when you stand up it pulls the pelvis forward and puts more pressure on the lower back. You might even have what we call a hyperlordosis curve just here. So if we can stretch these muscles out, it will certainly help with that. So the first exercise is we're going to do a lunge. So we're going to start off behind our chair. We're going to put our hands on our chair like so, and we're going to take a sort of a moderate step back. We're going to land on our forefoot, okay, so we're not going to have our whole foot down like that because that's more of a calf stretch. We're just going to be on our forefoot. And then we're going to just gently lower down like so. If you feel like you need to take more of a step back, then obviously do so. And as you start to bend that knee and start to lower into the stretch, you should feel this hip flexor stretching quite nicely. If we want to increase the stretch, just make sure that, we should really have our core engaged anyway so that we're nice and upright, but if we can really try and squeeze that core as much as we can, and also squeeze this gluteal muscle, so our bum muscle on this side. It will actually tilt the pelvis slightly further back and stretch in the front just here. And then we're going to come out of that stretch and then obviously do the other side. So again, this stretch, like many others, you might have one side that's tighter than the other. So obviously just make sure you spend a little bit of extra time on that side that is tighter. So we're going to hold it for around a minute or more if you can. Okay, and we're going to come out of that. If, however, you feel like you can progress that a little bit further, then there is an exercise adaptation on the floor that we can do. So we're going to do exactly the same thing. You might need something like a blanket or a hoodie or something underneath your foot. But essentially, we're in that same position. The hoodie is underneath your knee, just a cushion. And then we're just going to gradually move our body weight further forward. So we're increasing this hyperextension of the hip just here. And I'll show you from a different angle as well. So again, as we move our body weight forwards, this hip flexor will stretch more as the hip hyperextends. But of course, we can increase this stretch even more by engaging our core as much as we can and squeezing our glute on this side, and that will intensify the stretch. But obviously don't do it to the point where it's painful, we just want it to be uncomfortable. If you really wanted to test yourself, you can actually hold on to something for balance, and then if you're flexible enough, you can bring your foot up to your hand on this side, and that's really going to increase the stretch. You should feel it sort of down into the quadriceps muscle as well. Again, remember the other side for that. The next stretch is going to be standing, and this will also test our balance. So if you need to hold on to something, that's fine, but just try not to lean on whatever it is. Just use it as a touch, so just for balance. And essentially what we're going to do is we're going to bring our leg up to our hand, so we're going to grab our laces and we're going to pull our heel up towards our bum. Our knees are going to be together, so we don't want the leg coming out like that. And this is going to stretch the quadriceps muscle, because sometimes actually, because the rectus femoris, one of the quadriceps muscles, crosses over the hip as well as the knee. It actually acts as a hip flexor, and sometimes the tightness can actually track down into the quadriceps and the knee, potentially giving you some knee pain as well. Okay, and again, switch sides, and you might find that one side is tighter than the other. Once we've done that, we're going to move on to our final stretch, which is to stretch the outer quadriceps. And you may have heard a term called runner's knee before, or IT band syndrome. So essentially that's inflammation of the tendon and tightness of the tendon that runs down the side of our thigh. So this is our IT band. And also this will target the vastus lateralis, which is the outer quadriceps muscle. So when we're sitting down all day, sometimes the glutes, hip flexors can tighten up, placing more strain onto this tendon just here. So we're going to just, again, if you want to, touch something for balance. But in order to stretch the left IT band, we're going to move the left leg behind our right, okay? And essentially, we're just going to move our left hip this way. So we're stretching, and we should feel the stretch into the IT band quite nicely. And you should probably also feel it on the outside of the knee. Again, after our minute hold, we're going to switch and stretch the other side. So this time it's going to be right leg behind left, and then we're going to move our right hip towards the wall or chair that we're holding on to. Okay, and then we're going to come out of that one. So there are your exercises for today.